Hi, I'm Dr. Gunnarsson with TMJ and Sleep Therapy Center of Utah, and welcome to our podcast. I'm here with
Mindy. I'm the myofunctional therapist here at the TMJ Sleep Therapy Center of Utah.
And I thought that I would bring up, I recently ran across an article that came out in 2021 in the European Journal of Pediatric Dentistry, and it discusses the myofunctional therapy, purposes and reasons for it, and the development of the oral cavity. More specifically, it talks about how the teeth and the gums relate to this upper airway and what goes on inside all of this in the development and early stages of a child. And it did some studies that showed how in industrialized nations that development is getting smaller and smaller and smaller. But let's simplify that a little bit and ask, why does it really matter?
Well, it matters because the shape of the upper airway or the upper oral cavity is directly related with a lot of different things. It can be related to habitual mouth breathing if it's too small, and obstructive sleep apnea and sleep-related disorders. It can also be associated with appetite dysregulation, like those of you who have those picky eaters, and it can affect or impair cardiorespiratory fitness. So it is very important to consider this development of our upper cavity.
Okay, so a lot of people are wondering, is it our genes? Is it in our genes? Do our genes affect the growth? Is it our genes that are creating this problem? And in part, yes. Over time, we know that in the industrialization that we have seen mouths get smaller and smaller and smaller and smaller compared to underdeveloped or undeveloped countries, to where they are remaining nice, big, wide open. Their airways are nice, big, wide, and open. And so genes can play a part in what's going on.
But that's not the only thing that can play a part. So the things that we're eating can definitely affect our development. Back before the industrialization age, foods were a lot more tough, more rigid, harder to chew. There was a lot more mastication, chewing forces going on in the types of foods that we ate. And after the industrialization era, we started having a lot more soft foods, particularly in young infants, where they're primarily focusing on liquid and very soft, pureed, processed foods. Those are the critical ages for development as well.
Yeah, you were telling me earlier and talking to me that between the ages of 0 and 4 is when most of the development and the habits occur that start to develop. After age 4, we're into correction mode. We have to correct those habits. Up to age 4, we can train. But after age 4, it's now we're into having to correct, having to fix, having to widen arches using apparatuses or through orthodontics and different things.
Correct. The orthodontics and the myofunctional therapy go hand in hand in helping to correct those types of dysfunctions that have happened during the softer foods. We haven't taught or trained our kids as well with the softer foods to be able to use their muscles effectively to help with that creation of correct development of our bones and oral structures.
So a lot of people may be asking, why didn't my pediatrician or my pediatric dentist tell me about this and what was going on with my kids? Interestingly enough, we see a lot of it back east where they're a little bit more ahead of it than we are. We see fewer of that out here in the West, which is unfortunate because we're playing catch up in a way. But it's in the journals. But ironically, most of this is not ever taught in the schools. It's not taught in the schools of orthodontics. And so we're relying on these studies, these journal and publications in order to learn, teach us, and to develop programs that we can help our children. So when we're coming into this, a lot of people ask, can't my orthodontist just fix all of this?
That would be the simple solution, right? If just one person could be involved. But the real reason being why just an orthodontist can't fix this is because an orthodontist needs to be trained in airway protection, and not all orthodontists are. A lot of orthodontists are trained in fixing the smile, straightening the teeth, and are not trained in protection of the airway. And so if you have an orthodontist who's trained in protection of the airway, they can encourage and start referring you out as early as 2 years of age. If they're waiting until your child is 8 or 14 years of age, around that age, where palatal expansion can be done with appliances, or most of your child's primary teeth have been lost, then those ones are just going to be primarily correcting smile, unless you have brought your child in at an earlier age to see them, and then they can refer out earlier if they are trained in that type of a thing. So if that's how you can kind of tell if your orthodontist is going to be trained in airway protection. Of course, you can always ask too if they're trained in airway, and then see when they want to start treatment on your child. And then you can gauge from there on, are they really trained?
And of course, it's kind of the crux in it is the fact that if your orthodontist is waiting until they're 13 years old and they've had a narrow airway, a narrow upper arch, everything the nasal airway is now narrow, and they've been struggling all this time, probably diagnosed with ADHD, of course, because they're probably not sleeping very well, they're not breathing very well, but now they're going to put things into like a rapid palatal expander, an RPE, and that's where they crank down and force that upper archway and the width, and the faster you do that, the more scar tissue forms between, and we know that all of the bones in the skull aren't fixed to each other, they actually move slightly. And they're supposed to. And now when you create that fixed suture line in that upper arch, now that no longer can move and fix. So it would be my suggestion is, get into a myofunctional therapist. Many of them do free consultations like we do. Find a great one like Mindy. She does a great job with kids. And get your kids in and have them looked at. And then we can work along with that whole network that we have of orthodontists and pediatricians and get your kids going in the right direction.